Now, we've heard a lot about bioidentical hormones, but what are the different types and the pros and cons? Here with more is Dr. Clark Hansen from the Hansen Clinic of Natural Medicine. It's good to see you, Dr. Hansen. Thanks for joining us.
Yeah, glad to be here.
We've talked about bioidentical hormones. Why are so many women seem like they need them?
Well, we live in an environment now where we've got a lot of environmental pollutants that act like estrogens. They actually stimulate the body's receptors just like estrogen in plastics, in hormones that are actually fed into animals. The beef cows and dairy cows are fed estrogens. It's in pesticides and herbicides, and so we have a lot of that overstimulating our body. That taxes the body, creates an imbalance. Progesterone is supposed to be part of the balance, testosterone.
Right.
And we're getting out of balance, and women just don't recognize themselves anymore and think, what has happened to me?
Well, how do you know if you're out of balance or hormone imbalance?
Well, it's something we can test. So we do a blood test and measure all the hormones. Most doctors don't test. For years, pharmaceutical drug companies have made a one-size-fits-all. And recently found out that those drugs are not just a little bit harmful, they're causing cancer, double the risk of getting breast cancer in a woman. 50% increased risk by taking these synthetic estrogens.
The synthetics.
Yeah, so you want to avoid them.
Right.
So we talk about bioidentical.
Right.
Right, that's what women need to learn the difference, because they've seen the news that the estrogen is actually a known carcinogen now. And the synthetic ones are the problem, not the bioidentical. So bioidentical means exactly like the body makes. And the only reason drug companies don't make them is because of money. There's no profit in the natural ones because God holds the patent to those natural plant extracts that are bioidentical to our body. In order to get a patent on it, you have to make something that's unique in nature. So go to the patent office, it has to be something that's never been seen on planet Earth before. So they copy the natural ones, but then twist it a little bit, add something to it. That creates a lot of toxicity, increased risk of strokes, heart attacks, as well as cancer.
Now let's take a look at some of the ones we should test and what we should supplement. These are the good ones. These are the ones you should be supplementing. So we have a little graphic here that'll kind of run through them for you. We'll start with that first. The first one being estradiol.
Estradiol.
Estradiol. I never say it correctly. Estradiol.
The one that has the dye in it, you don't want to take.
Okay.
So estradiol is the bad estrogen. It actually increases a woman's risk of cancer, increases it by 10%. If you add progestogen, the synthetic progesterone, to it, it increases a woman's risk of cancer by 50%. Okay. So estriol, that's the third estrogen, that's the good estrogen. That actually is anti-cancer properties. So it actually prevents breast tissue proliferation, it actually prevents cancer. So it should be used as a treatment for cancer, but it's kind of been ignored because it's actually 1,000 times less potent than the other estrogens.
Well, you can see why people get confused. The names are so similar. Let's put that back up again. So we talked about estradiol. Or
estradiol.
Estradiol. See how it's confusing? Okay.
Yeah,
and
it is a little bit.
progesterone is the other one now.
Progesterone and testosterone, very important to get those balanced as well. Progesterone is the best osteoporosis preventer. It builds bones. It's also an anti-cancer agent, and it also elevates your mood, helps with anxiety, helps with sleep. And testosterone helps with libido, energy, depression, and heart. Prevents heart disease, prevents cholesterol, raises the good cholesterol, makes you feel great. So a lot of women are feeling depressed, anxious. It's, you know, this whole imbalance.
Sure.
Mental fogginess, poor sleep, waking with hot flashes.
What's the best way to take these? I've heard of all these different methods. Is there one that's better than another? Yeah,
so there's 4 different main ways that women are seen using these different applications. So oral pills, just swallowing them. We've got a slide that's going to show this for women. You take the oral pills, and it's convenient, but it's poorly absorbed. So only about 20% gets absorbed. So it just doesn't work very well. It's eliminated by the liver. The creams, they seem okay because they're a pain to put on different places every day. The skin is meant to be a barrier, eventually blocks it. The pellets, a lot of women are hearing about the pellets now, injecting a pellet underneath the skin. Sounds real convenient, lasts for 3 to 4 months. But it's a surgical implant. In order to be available surgically, it has to be irradiated. The FDA requires it either be irradiated with radiation, that leaves a little bit of residues in your body, or ethylene oxide, which is a neurotoxin, not good ways. And then it's the estradiol, because it's the one you don't want, the bad estrogen. They can't use the good estrogen because it has a very short half-life. You have to take it every day.
Right, and you recommend here the ones that you take underneath the tongue.
These are called sublingual. This is the best way to take it. So this is estriol, the safe estrogen, progesterone, and testosterone. And these are all pull-apart 2-piece capsules, and you just pour the powder right under your tongue. It dissolves quickly into your bloodstream. You take it every day is the only drawback.
Right.
Otherwise, it works quickly. My patients within 2 weeks are sleeping through the night.
Feeling a lot
They're
better.
feeling great again. They
And-
feel like themselves again. They're happy, energy, their sex drive comes back.
And I know people are watching going, well, I want to check this. So you have a special promotion for somebody who
Yes,
wants to
so
come in.
go to my website, check out all the information we have. You'll see stories about patients and great results they've had. Sign up for our newsletter, and you'll be entered automatically into a drawing to win a free hormone test.
There you
So we'll
go.
do the blood test. Anybody that wants to know more information, call our office. I'll talk to them, or come in person.
Okay.
We'll chat with you, and we'll find out specifically what we
Perfect,
can
and
do
get
for
some
you.
answers for why you've been feeling blah. That's my
Right.
technical word. Now, if you would like more information on Dr. Hansen, of course, you can go to the Hansen Clinic of Natural Medicine by going to drhansen.com, or you can call the number you see right there on your screen.